Portal Pro is very easy to set up. Just pull on the back seat and lift at the same time to get the back legs off the ground. Then lock the cam locks in place and do the same with the armrest. Now the chair is ready to sit in, but first we're going to adjust the height and angle of the chair after we take off the plastic covering of the rubber feet. The cable system is how we adjust the height of the chair. In the lowest height settings, we can see that the client is relatively low down and angled forward. In this time-lapse photography, we can see that as we change the height of the cable, we can change the height of the chair. The client is becoming more vertical and is at the same time raising up higher off the ground. In order to do this, we lift the back of the chair and get the rear feet off the ground and take out the little Z-clip out of its hole. The higher settings are good for taller therapists, and the lower settings are better for shorter therapists. Generally, I suggest starting in the third or fourth hole from the bottom. We reinsert the clip and pull back until there's tension in the cable, and at the same time we make sure that the Z-clip is parallel to the tube. And here you can see there's no slack in the cable almost. Then we adjust the height of the seat. This not only adjusts the height of the seat, but at the same time changes the angle of the seat. The best general position to shoot for is to have the plane of the seat intersect the front of the leg rest pads. Next, we will take out the face rest by loosening both cam locks and the knobs. And if we take off the pad with the backer plate, we can flip it over and put the cam locks on the side of our stronger hand. I recommend you do this when you first get your chair. After that, you won't need to do it again. Then you need to select what kind of face rest covers you want to use. We have flannel covers, which you can buy from Oakworks, which are very comfortable and washable and fit the face rest. And we also sell nurses' caps as protectors. And on the box they show you how to cut the nurse's cap and make this little V shape, and you just tuck that underneath there. These are very inexpensive and work quite well. To get your client on your chair, first show them how to get on the chair by straddling and holding on to the chest pad. Ask them to sit and hold on to the chest pad and release both cam locks on the face rest and the knobs. Now the face rest can be brought to any position that's comfortable for them. Tell them to rest their forehead on the pad and lean forward until they're comfortable. A little communication is usually necessary to find the most comfortable spot for your client. Then lock the two cam locks and then the knobs. It's important to do it in this order. Then we can adjust the height of the armrest and the angle of it by releasing the cam lock on the armrest and lifting it until we can see their forearms are in good contact with the pad and their shoulders are slightly rounded. At this point, we can lock the cam lock and then adjust the length of the strap by pulling on it. Now your client is ready to be worked on. Here's some other helpful ideas. For taller or thinner clients, generally the face rest being located forward is the best idea. For shorter or obese or large-breasted clients, the face rest moving backwards towards them will be more comfortable. And with all clients, you can adjust the width of the pad to make sure their face is supported comfortably and they won't be pushed through by taking the pad off of its little backer plate and adjusting the width. We can also adjust the chest pad. It's attached with Velcro and can be moved up and down and turned sideways. You can experiment with this to see what's comfortable. For most clients, there's no need to adjust it at all. We also have the triangular shaped sternum pad, which is excellent in a vertical position for doing shoulder work or for working on large-breasted clients. If we lower the armrest down out of the way, it'll allow us to have more freedom of movement for the arms. In this way, shoulder work is extremely easy on the Portal Pro, and you can get more work done on the Portal Pro than you could on a treatment table. By supporting the head and neck area, you can feel comfortable that your client is relaxed while you do the shoulder work. The Portal Pro is a great product to use for any upper body work that you would want to do on athletes. And the sternum pad can also be turned in a horizontal direction. In this way, when located on the ribs just below the breasts, it's extremely comfortable for pregnant women. If you have someone who's having a hard time getting up to a comfortable position in using the face rest, adjust the height of the seat angle a little higher. To change the amount of knee flexion, you'll find it's more comfortable at the high heights than it is at the lower heights. But at any height that you set the chair at, you can always tell your client to put their feet flat on the ground if that's more comfortable for them. You can also use a stool, such as this one sold by Oakworks, to help you make your work easier. It's adjustable in height and on wheels. In this way, you can move around your client and sit down comfortably while you do your work. You can also have your client sit backwards in the chair. You could take the face rest pad off and turn it upside down and use it as a cervical support. But the sternum pad works even better for this purpose. Just install it on the face rest platform and release your cam locks and knobs and move it to a position which is closer to the client than you would normally put the face rest, and locate it so that the point of the pillow will be in the cervical region of your client. You can do this while they're sitting down, or you can take a guess at it before they sit down. Have the client sit down. For shorter clients, they will find this position is not comfortable because their feet will not reach the ground. For medium and taller clients, that won't be a problem. In this way, it makes it very easier to work on the anterior parts of your client and to work on their feet and legs. To fold up your chair, make sure that the push button is in the third hole from the bottom. This is very important. Then lean your chair forward and push the seat in as shown. Drop down your armrest and relock the cam, and do the same on the face rest. Put your foot on the wheels to keep the chair stabilized. The new wheels make it very easy to move the Portal Pro around. Next, let's adjust the position of the face rest so that we can grab the spacer tube shown here easily for pulling the Portal Pro. Loosen the knobs and retighten them so that it's easy to grab and hold on to the spacer tube. Then, simply lean the chair over and pull it behind you. It's designed to protect the pads and keep them far off the ground and roll on any surface. To carry your Portal Pro, rest the seat against your hip and grab onto one of the main tubes. It's shown here with the optional shoulder strap. The optional carrying case makes it even easier to carry, but first you'll have to flatten out the chair as much as possible. So release the cam lock on the armrest and take the tension out of the strap system to fold it down as flat as possible. Take the face rest and fold it down as flat as possible also. Then take your carrying case with the zipper most of the way open and drape it over the top of the chair as it's standing and zip down as far as you can. Then put the chair on its side and bring it up over the top and close it all the way. It's important that the chair is folded down very flat in order to get it to fit. The carrying case protects your chair and makes it even easier to carry. It comes with its own shoulder strap and a set of handles. Caring for your Portal Pro. For cleaning your Portal Pro, we recommend that you use several different products. To get oil off or dirt, we recommend that you use 409 or fantastic, or mild soap and water. If you wish to disinfect your vinyl, you can disinfect it safely with a 10% bleach solution in water. The vinyl is very easy to clean. If you get a tear in your vinyl, order some VLP from Oakworks and use it in this way. Make a small bead of it inside of the rip. Then take some common Scotch tape and stitch it across by first stitching it down on one side carefully and then pulling the vinyl until the tear is closed, and then stitch it down on the other side. And we repeat this step until all of the rip is repaired. In about 20 minutes, you could take the tape off, and the table will be ready to use, or chair, in about 1 hour. This will pretty much make it disappear. You'll still see a small line, but it will be quite strong, and you shouldn't have any problem with it. The VLP is sold inexpensively by Oakworks. If, however, something happens to your pads a little more extreme, almost all the pads come off easily since they're attached with Velcro, so you can take them off and get new ones sent to you. The armrest is the only one that involves a little more work. It has 3 Phillips head screws which attach it. Just back the screws out and the whole platform will come off. The desktop portal is the little cousin to the Portal Pro. It only weighs about 8 pounds and is very easy to carry around and offers a lot of the versatility the Portal Pro does in terms of upper body work. It has many different adjustments. It has an angle adjustment for the chest pad. Angling it forward will offer the most relaxation for your clients, but is only possible if you can get the client up high enough on a chair. More obese or shorter clients, or clients you can't get high enough on a chair, will demand that you use a more vertical position. Lock the cam locks on either side, and you can also use the chest pad by moving it up and down to find the best height for your client. The sternum pad also works on the desktop portal and can be used in the same ways it was used on the Portal Pro. The face rest system has the same adjustments. Remember, whenever you change the positions of the face rest, first loosen the knobs. You can see that there's a large height range and that the cam locks can also be used to change the angle. In a second, I'll show you how to actually adjust it for a client. First, however, we want to be able to get our client as high as possible so that we can lean the chest pad forward. So, if possible, use a pneumatic lift stool or chair. Then have the client sit down on it and move close to the tabletop. We'll have them lean forward into the face rest pad until they feel comfortable, and then we'll lock the cam locks and knobs. In this way, they'll be comfortably supported in the neck and head region. After we have everything locked up, we'll ask them to reach forward and cross their hands or arms, and then we're ready to work on them. There's another way that you can also set them up and get them adjusted comfortably. In this second way, we will decide what will be a good angle for the chest pad to be at, and we will lock those cam locks before we ask the client to move forward. Then we'll lift the face rest and ask them to lean forward on it, and lock the 2 cam locks and the knobs on the face rest. This system is a little faster, but takes a little better understanding of how the chest pad angle needs to be set. The desktop portal can also be used as a prone pillow on a flat table. By releasing all of the cam locks and knobs, we can get it to lay perfectly flat. Then, if we angle the face rest and lift it slightly and relock those 2 cam locks only, we will be able to create a comfortable position with good airflow for the client to be able to breathe in a face-down position. You can also lock the cam locks on the chest pad. This is a very comfortable position for most clients for lying face down. The face rest can also be taken out of the desktop portal and utilized in other products that Oakworks makes. To fold up your desktop portal and put it in its carrying case, we'll get the face rest back inside and release all of the cam locks so that it can lay flat. The small optional carrying case is a relatively snug fit and gives a good look to the package. Just slide it in and zip it up.
The following massage sequence is an example of a 15-minute massage session. Begin by kneading the trapezius. Work out from the neck to the AC joint, your acromioclavicular joint. Then apply uniform and alternating palm pressure on the transverse processes of the spine and the erector spinae muscles as you travel the length of the back. Work from the neck, the cervical region, down to the sacrum. Then work back up and knead the trapezius again. Now begin cross-fiber frictioning the trapezius from the cervical area out to the acromioclavicular joint. Sink in deep to the tissue and establish a good solid rhythm. Be sure to allot enough time in your massage to address areas that need additional attention. Frequently, these areas are the neck and the lower back. Now cross over and work the other trapezius. Next, you will move to applying cross-fiber friction up the transverse processes of the cervical spine up to the occipital ridge, affecting the sternocleidomastoid muscles and supporting cervical musculature. Again, be slow and deliberate with your strokes, applying appropriate pressure. And don't forget to check in with your client. Ask them how the pressure is and how they feel. apply a momentary kneading as you do the transition stroke to the other side. Knead again and apply scalp massage. Keep in mind when working on people in offices that they don't like to walk away from the chair looking very messy, so insert your fingers through the hair as opposed to roughing up the hair. Move to the front of the chair and grasp the occipital ridge from the front and work along the border. Return again to the back of the chair and work your way down, ending with knuckling in the lumbar region, working on the erectors and out laterally along the iliac crest. Circular friction along the crest is very effective. Now moving back up with alternating pressure, cross to the deltoid and work the region. Then working down the arm, knead the biceps and triceps, moving further down to the flexors and extensors. While working on the arm, it's best to rest a hand on your thigh for comfortable positioning for your client. At the wrist, flex the wrist, applying alternating pressure to the carpals. Then work down the hand, massaging the hand. When working the palm of the hand, pay particular attention to the area under the thumb, the thenar eminence. As working along the fingers, apply slight pressure, slight pulling pressure when drawing off the tips of the fingers. Then move the arm into a relaxed position and apply rotational shaking up and down the arm. For best effectiveness, the shaking should be applied rather vigorously. Now cross over and repeat the steps on the other arm. Again, when doing all of this work, make sure your pressure is firm and controlled, and continue to check in with your client as you work. Transition to your client's back. Apply some more kneading on the trapezius, little alternating palm pressure. Work your way back up from the sacrum and begin the final steps, which will include various forms of deportment. This is both invigorating and relaxing at the same time. Take care when deporting not to strike directly on the spine. And finally, when you've completed your deportment, close out the session with some light sweeps of the complete back. You should now have a client that is happy and ready to proceed with their day.